Leonora, is it a bit weird celebrating a agency of the state?
Yes, I think it probably is. I mean, I think the opportunity with the 75th anniversary is an opportunity to think about our health service and where we want it to be. Um, do institutions have birthdays? I tend to think they don't. I tend to call it the anniversary of the founding of the NHS personally, rather than the birthday. Leave that to others. But I think that the opportunity here, and that's what we're doing with this letter, is to try and think about actually what kind of healthcare system do we want for the future, and are we getting it at the moment, and if not, why not? And I think what we're saying to the political leaders is that the short-termism that affects health policy is really damaging. And so and what do we mean by short-termism? Kind of quick political fixes, pledges to on quick targets, or on we're going to have this many more staff, but without actually doing anything to fundamentally address the reasons that we're struggling to do those in the first place. So that's why we're using this opportunity to try and make that point really, and get a bit of a focus from all of the parties on moving beyond that kind of the addiction to short-termism.
Last week's announcement from Rishi Sunak on the workforce plan, was that the sort of thing that you'd like to see a bit more of, albeit a bit late in the day?
Yeah, exactly. So yes, credit where it's due. The government did last week what we and many organisations have been saying for years. I remember working on a piece of work back in 2018 when we were talking about the need for long-term workforce planning, and it's been a long time before that as well. So yes, the workforce plan last week does signal something quite welcome, which is really good modelling, really good evidence to underpin that, and a lot of kind of good intentions. The challenge is, as you say, it came late. It's one area of what we're talking about. So the other areas that we put in the letter are things like looking at the kind of buildings and equipment that people have in the NHS to do their jobs properly. And we have a woeful history of short-termism in that area. I mean, dating back to the 1970s, where we have ended up, making cost savings on hospital design, which meant that during the pandemic, we were quite unusual in Western health systems in having hospitals that were really not fit for purpose. So buildings and equipment is one. Social care is another. So you'll remember, Boris Johnson standing on the steps of 10 Downing Street saying, he's going to fix social care once and for all.
Oh,
This is
yes.
something that everybody talks about, and nobody is really able to do it because it's really difficult, and it requires cross-party consensus, it requires funding, it requires difficult conversations with the public, but it has to be done because the consequences of not doing it are also really costly and expensive, and that's what we're seeing as well. And the NHS and social care have had a long history of having emergency one-off cash injections particularly over the last few years. And the problem with that is that then, the sector isn't resilient to dealing with the sorts of shock that it saw in 2020 with the pandemic. So it's not like, choosing to do this short-termism is well, we're muddled through it and it'll all be okay. Actually, it comes back to bite you, and that's what we're trying to make the case about today, really.
And just finally, the warning that it might not survive to its 100 years isn't the more likely thing is that it carries on for the next 25 years as it has done in the last 25 years, with blasts of money, blasts of there not being enough money, blasts of long-termism, blasts of short-termism, and it'll still be there because ultimately nobody is going to change the fundamental underlying basis of free at the point of use.
Yeah, I mean, it depends what you mean by it being there, and I think what the risk is that muddling through as we are, and with this short-termism, means that we end up continuing the managed decline that is really happening already in the NHS. And then you kind of think, well, what actually is it? And we know that the NHS has these very kind of clear founding principles of universal healthcare, free at the point of use, available to all. It's not going to be that if we're having to have people waiting, years on waiting lists, and the system is effectively heavily rationed by weights. So it may be that there is still an NHS logo and there is still, people working for the National Health Service. Because you say, what, the the kind of, well, what is the alternative?
Yeah.
I mean, we have particularly Conservative Party politicians recently, talking about social insurance, and that's a whole other debate. But actually, you need to provide healthcare. The real problem is if you muddle through, you end up not necessarily doing what people want and expect. And don't forget that the public are actually really supportive of these general principles. They want a health service that is free at the point of use and available to all. They want one that works. They want one where they don't have to wait extremely long time to get access to care. And that's all possible, but it has to be it has to be done with more long-term planning, build on the good work that the workforce plan has set. It is possible to do it, and cross-party consensus as much as possible. And it was a bit interesting hearing the politicians you spoke to this morning, because the NHS is so politicised, and electoral cycles really do impose a short-termism
Yeah,
on it.
yeah.
But it's vital to do that long-term thinking.